Alexander Fleming was born on August 6, 1881 in Scotland. He was the third of 4 children of Hugh Fleming and Grace Moran. Fleming went to school in London, where he attended the Royal Polytechnic Institution. He then enrolled at St. Mary's Hospital Medical School. He qualified with an MBBS degree in 1906. He became an assistant bacteriologist to Sir Almroth Wright. In 1908, he gained a bachelor's degree in bacteriology. Fleming served in World War I, where he worked in battlefield hospitals at the Western Front in France. During the war, Fleming witnessed the death of many soldiers from sepsis. Antiseptics, which were used at the time to treat infected wounds, often worsened the injuries. In an article he wrote during World War I, he explained why antiseptics were killing more soldiers than the infection itself. Despite this article, most Army physicians continued to use antiseptics, even in cases where this worsened the condition of the patients. At St. Mary's Hospital, Fleming continued his investigations into antibacterial substances. Testing the nasal secretions from a patient with a heavy cold, he found that nasal mucus had an inhibitory effect on bacterial growth. This was the first recorded discovery of lysozyme, an enzyme present in many secretions. However, the enzyme was only effective against small counts of harmless bacteria and therefore had little therapeutic potential. By 1927, Fleming had been investigating the properties of staphylococci. He was already well known from his earlier work and had developed a reputation as a brilliant researcher, but his laboratory was often left untidy. On September 3, 1928, Fleming returned to his laboratory after a vacation. Before leaving, he had stacked all his cultures of staphylococci on a bench in a corner of his lab. When he returned, Fleming noticed that one culture was contaminated with a fungus, and that the colonies of staphylococci immediately surrounding the fungus had been destroyed, and he famously remarked, "That's funny." Fleming grew the mold in a pure culture and found that it produced a substance that killed a number of disease-causing bacteria. After some months of calling his discovery mold juice, he named it penicillin. Fleming published his discovery in 1929, and by D-Day 1944, enough penicillin had been produced to treat all the wounded in the Allied forces. He was knighted in 1944 and won the Nobel Prize in 1945. His discovery of penicillin has greatly impacted public health today.